In this short video, I will give you 5 essential facts about phlebitis to help inform you when you come to make your decision about whether to have specialist treatment. I will cover what it is, what it looks like, what causes it, when it is a problem, and how it can be treated. So let's start with what is it? Well, phlebitis, or as it should be called, superficial vein thrombosis, is an inflamed superficial vein containing clot. What does it look like? Well, the skin overlying the tender, lumpy, hard vein is red. The affected vein is usually on the lower inner thigh or calf. So what causes phlebitis? Well, in most cases, it's caused by varicose veins. Varicose veins are prone to clot formation because the flow within the vein is sluggish and the valves, those delicate folds in the inner lining which open and shut and which keep blood flowing in the correct direction, are often roughened and floppy. The clot within the vein then causes an inflammation and the clot can spread. One area of confusion is the fact that it's not an infection. Phlebitis is not caused by bacteria and antibiotics are not necessary. Of course, there are other causes of phlebitis which need to be considered. So in addition to having varicose veins as a risk factor for phlebitis, you're more at risk if you smoke, if you're overweight, if you take the pill, if you're pregnant, if you've had a previous clot, or if you have a condition which makes the blood sticky. Another important group of people who are at increased risk of phlebitis are those who have cancer or who have recently been treated for cancer. So, when is phlebitis a problem? Well, phlebitis in varicose veins often recurs, and so people with this complication of their varicose veins should have treatment to deal with these veins to prevent them having another episode. Of course, phlebitis can lead to a DVT if the clot is very close to a deep vein, and so it's an important reason to have treatment to prevent potentially serious deep vein thrombosis and pulmonary embolus. And in addition, phlebitis, in the absence of any varicose veins, is a particularly worrying condition because some people with this condition have an unsuspected cancer, and so careful screening of these people is needed to ensure that if they do have a cancer, it's treated as soon as possible. So, how can phlebitis be treated? Well, in the short term, you can manage the problem yourself by keeping active and elevating the affected leg. Under the advice of a healthcare professional, and in the absence of any other health conditions such as diabetes or artery disease, good quality medical grade compression socks should be worn during the day, and the skin should be moisturized after taking the sock off before going to bed. Many people get relief by applying a cold flannel over the vein to ease any pain. And if you don't have any allergies, consider taking an anti-inflammatory painkiller such as ibuprofen. Now you can take this by mouth, or if it's a small area of phlebitis, you can rub a cream or gel onto the area. If you're not sure whether this is right for you, ask a pharmacist. Now for a more longer-lasting solution, if you have phlebitis affecting a varicose vein, a vein scan and the advice of a vein specialist should be sought. Vein treatments for varicose veins and phlebitis can now be carried out very safely under local anaesthetic as a walk-in, walk-out procedure using a non-invasive treatment. Now, if you'd like more information on phlebitis and its treatment, visit my website, theveincarecentre.co.uk. My name is Dr. Haroon Gadraj. Thank you for watching.